My name is Carl Brown. I'm a psychotherapist and member of the Canadian Society for Clinical Hypnosis, the Ontario Division. And here with me is Chris Lobsinger, also a member of CSCHOD and a social worker in private practice, who is hopefully going to answer my questions about hypnosis. Are you ready to go, Chris?
Sure am.
What is hypnosis?
Well, people have been trying to answer that question for, well, as long as modern medical history, hundreds of years. So essentially, the 21st century idea lands somewhere. We know it's a brain state that's a little, if you want to use a metaphor, a vertical metaphor, it's a little above sleep. And so, for example, children are in a state of hypnosis. We know children under 10 usually all the time. And hence they're so suggestible. They'll believe in Santa Claus and the Easter Bunny and all sorts of things because their critical evaluation ability because of their brain development isn't quite as what it is when you're a teenager or an adult. And so what I would add to that biological description of hypnosis is the functional 21st century is if you're a health professional watching this or just a regular person and you felt a good sync, or professional people use the word rapport. If we had brain scanning available live to both you and whoever you're hanging out with,
It'd be in sync.
that's hypnosis.
Okay. There's two or three things you mentioned, Chris. It's a state that's just above sleep, so it sounds like it's something different from normal consciousness. It's a state that children run around with continuously, so that suggests to me more of a play state, which kind of appeals because I am a playful person. And then you also talked about suggestibility, that people who are under hypnosis are more suggestible. So I guess that kind of makes me jump to my question of, so does that mean I'm going to lose control if I allow someone else to hypnotize me? Are they going to suggest things to me that I don't want to do necessarily?
It's a common myth. And so what hypnosis actually accomplishes is, if you think about going back to a kid, how fast a kid can learn something. And so part of the reason they can learn fast is because when you're in that hypnosis state, it's really just a learning kind of supercharged learning state. And so you also have a lot of access to resources that you normally consciously wouldn't have access to. So it's, if you think about maybe say 10% of the brain is your conscious mind, 90% is subconscious in this relaxed, sort of like a daydream state, not even the zombified kind of hypnosis that people see on TV. That's not what we're talking about. Just a light, like a daydream. Everyone has a daydream at least once a day, probably several times a day. And that's your brain's natural way to go into hypnosis, to rest or learn something or just space out.
Okay, so I guess that answers the question I was going to ask you, or at least partly, how can it help me? It sounds like it could accelerate my ability to learn new things.
Yeah, so when that's from a control perspective, we don't lose control in this supercharged learning state. We actually increase control. If I said to you, do you know how to make your arm go completely numb so you can have a painless injection? You might not have ready access to that right now, but everyone knows how to do that.
Okay, so that's why you do this, and why do you as a therapist do hypnosis?
Well, any healthcare professional, right? People come because they have some concern and they want to get a consult or get some relief from that concern. And so the research shows that just that context, the healthcare provider talking to a client or a patient, hypnotic things are happening in that interaction because there's rapport. So say, for example, when the patient feels understood, right, that's a sign of rapport. Oh, I feel like my therapist or my doctor is getting me.
So hold on. So you're saying that when I'm doing my work, because I'm a therapist too, when I'm doing my work well, I can't avoid but use hypnosis. It's happening in the room.
When you feel it's going well, it's quite highly likely that the other person feels like you're getting them.
Okay. And getting back to that, if you could do that contemporary brain scan, you'd see some sync between me and my client at that point.
There's already been research to confirm this.
Yeah. Now, how can I learn how to use this more effectively in my practice?
Well, for registered health professionals with a master's degree or even graduate students who are in a qualifying program, they can take a introduction to clinical hypnosis course with any of the legitimate societies, and our own society here in Ontario, Canadian Society of Clinical Hypnosis. Well, at least annually runs a 2-day intro, but so
Well,
do
we
the
have
other.
one coming up. Yeah.
We have one coming
Mhm.
up March 1st and 2nd. And so, but no, there's lots of other legitimate hypnosis societies who only teach clinical hypnosis to regulated health professionals, which is the international standard for legitimate clinical hypnosis.
Mhm. And what can I expect to learn in your introductory course?
Well, like anything, we teach all the basic things. So you learn to kind of the principles of how to invite somebody and some of the practices. And then how to integrate that into your own specific practice. So whether you're a therapist or you're a medical professional, you might be a dietitian, you might be an OT. I mean, we've had nurses, we've had all sorts of different health professionals over the years. And so then we'll teach you the basic sort of structure of this and some of the language, because there's some language differences, and but then how to quickly integrate that, because of course, going back to what I said earlier, we presume you've already been doing hypnosis, you've already been doing some hypnotic things with the people in your care. Now after an intro, you're going to be, oh, and
Oh,
see
oh,
those opportunities, and you'll be able to utilize those opportunities to get even more in sync and enhance that person's change to resolve their problem even more effectively, even more rapidly than what would usually be if there was hypnotic things happening and you don't know it's happening. So then you don't know how to utilize it.
okay, so you're going to teach the theory, the nuts and bolts of hypnosis in this course, and that's going to help me become more aware, A, of how I'm already using it, and then also there'll be opportunities to practice.
Oh, yes. I would say probably almost a third of the 2 days is actual supervised practice with our teaching faculty. You and I are both on the teaching faculty. And so, and we have a few other people as well. And so, and these are small group learning things. So it's not like you're going to be in a thing with, 500 people. These are small groups. And then when we practice, we have breakout groups with just 3 people, which is overseen by some of the teaching faculty. So you get some very close coaching. And so that's why we're so confident that people the very next week will be able to go into their own practice and be able to use this right away. And then we have, for people who join the society, we have monthly meetings. We had one today. And so people can come and ask questions and continue to build up their skill. And of course, the society, we have subsequent workshops that people can take as well.
Well, you mentioned about, the very next week I'll be able to use this. I mean, that's actually the assignment, isn't it? You're going to send them out to
Oh, that's
practice.
right. We give an
Yeah.
assignment. There's homework, You remember
Ah,
folks, homework? I'm like, oh, you thought I'm licensed now. I'll never have to do homework again.
ah.
Yeah. So what we do is we just ask you to pick someone to do something. Usually just getting somebody into hypnosis and re-alerting them. It doesn't even have to be working on a specific problem, although that sometimes can be good if you have that as well. But for people who, for whatever reasons, they don't have someone who's willing, then, they can just find someone who's willing.
What prerequisites do I need to take this course?
So, as I said before, regulated health professional, or at least be able, you're on a track in graduate school.
Now, when you say regulated, you mean regulated to perform psychotherapy then? So
or
doctors,
medicine,
nurses, sorry?
or medicine. dietitians. People can search this. We're in Ontario, so there's, I think, 6 colleges
Yeah.
that are regulated health professionals, and so all those people would be eligible.
Any of
And
the regulated.
students,
Okay.
of course, that are in those programs at the graduate level, master's or higher, we would welcome those folks.
Very good. Where can I get more information about the course?
Well, you can get it at our website, Canadian Society of Clinical Hypnosis, Ontario Division. Search that. And I think it's just, I don't know what it is off the top of my head. Do you know, Carl? Is it CSCH?
Now, that's a really good question.
I think
Uh,
-od.ca might be the.
You got it right. CSCH-od.ca.